My name is Emily Lester and I am 26 years old. I live in Muncie, Indiana. I am taking this course as a requirement for my bachelor's degree, which I hope to obtain within 2 years. I am a nurse currently with an associate's degree. I am considered a sophomore in college, even though I already have a degree and a technical certificate. I will eventually hope to get my master's degree and become a nurse practitioner. I am the oldest of 4 children. I have 3 other siblings. I have a brother just younger than me, and then 2 sisters. You saw one of my sisters in the video. She was the one in the Navy sweatshirt. She just graduated from high school. Congratulations. I am very close to my mom. You may have seen her also. She had on a navy blue t-shirt. She is also graduating this year with a master's in education. She has 1 more class and 2 Saturdays, and then she will be finished. I'm very proud of her. We are very close. We do a lot of things together, and we talk a lot. She's my best friend. I'm also close to my grandma. My grandma just came to live with us this evening. Part of the reason that this tape is late, or speech rather, is because my grandma is not doing well. We don't expect her to live long. She's come here so that we can give her the best care possible and allow her to die with dignity. This is what everyone deserves. I used to have so much fun with my grandma in the summers. I would go and spend months at a time at her house. We would go to the library or go to a little town called Crawfordsville near her, where we would shop in little shops, go to the bookstore, or even go to Target when Target was a big deal. I'm very sad that she's not well anymore, but I'm glad that we are able to provide her with the care that she deserves. Which brings me to what I do for a living. I am a nurse by nature and also by choice. I work in radiology. You may think it sounds funny that a nurse will work in radiology, and you may ask, what does a nurse do in radiology? Well, nurses are very important. They are around if patients have a reaction to IV dye, which is sometimes common. If you have an allergy to shellfish or iodine or a previous IV dye reaction, you may need immediate treatment. A reaction to dye is very serious and can lead to death. So I must be ready with my medicine, such as Benadryl or a steroid, to make sure that you have a good outcome. Other things I do in my department are work up patients, gather their health histories, check for any medication conflicts, start IVs, anything to get them ready for a procedure that we might do called an angiography. Angiography is looking at arteries or vessels in the body to see if they have clots or narrowings. Clots can be caused by anything, but narrowings are most usually caused by poor health choices, such as diet or smoking or other things like that. My job is very interesting. My favorite test that we do is called a cerebral angiogram. It is where we map the vessels in the brain. You can watch the brain fill in one side, arterial, and empty the other side, venous. And it's just one side at a time. It's very interesting. We also recover people in my area. To recover someone, you must watch them for reaction of the IV dye, bleeding from a puncture if we've punctured you in your artery, or also recover you from the sedation we may give you to help you with your anxiety. I plan to stay in my job, and if I become a nurse practitioner, I may want to work in radiology and help perform some of the procedures. We have a nurse practitioner in our department right now, and I really look up to her. I work Monday through Friday with a call schedule, and that means that they could call me in any time of day or night to save a life. Most of my friends are from work, and I usually don't do anything outside of work besides work on schoolwork. Well, it was very nice to meet you. And I hope you have the best weekend or week or whatever. Thank you and goodbye.